What can I do as someone who isn't in a leadership position, but knows the importance firsthand of prioritizing and talking about mental health and wants to help others?
Yeah, I think this is another excellent question as well. I think that there's lots you can do. I think there's so much more focus at the moment or recently around mental health. People are able to have conversations around mental health much more readily than when I first started in this industry. Taking a mental health day is an acceptable sick day now, which is great. But I still think there's lots more that we could be doing in the workplace to support this. What I would say to answer this question is there's lots of resources out there that you can get involved with, yourself and the project you run, but Are You Okay? And projects like that do provide resources for individuals to get involved with having conversations around mental health and the tools that you need to have good conversations around people's mental health. You can actually, as for Are You Okay, you can be the organization's champion. In fact, they're looking for those kind of people that seek out the information, talk about it, make it part of the agenda point for the agency to have that conversation, to make it a big thing on Are You Okay Day, for example. But also there's things like mental first aid training as well. So mental health first aid training, which is something that all agencies should have. There should be a mental health first aid officer for every organization. So that's something you can certainly put your hand up for and be part of. And yeah, I think having those resources in the agency is so important, because some of the conversations can be super tricky. And people aren't really trained to have excellent conversations about that. So having resources available or knowing where to go. I'd say the other thing to look for as well, and this might be in sort of larger agencies, are the tools that they might have to support employee assistance programs, essentially. So we at Paper Moose, we use one called Sonder, Sonder, which is a sort of app platform which provides lots of really useful tips and video guides on how to have good conversations around mental health. But it's just broader than that as well. It's just a support platform. But there's a way through that you can actually hook into a counsellor and have speak to people when you need to take it a little bit further. So yeah, seeking out that kind of information and what's available for you.
Yeah, excellent. I agree with the mental health first aid stuff. That's a great way to just learn about how to have a conversation, whether it's mental health or not. I think the other thing I found doing that course was it's actually quite a good leader course, like to be able to understand that, hey, looking for signs and seeing and having the empathy to think about what somebody else might be going through as to what might explain their behavior means that you're not judging and you're not making assumptions about people as well, which I think is a great way to help. The other thing we're going to say is that we're working on a project at the moment where we are hoping to activate all the mental health first aid trained people in our industry who have been trained over the last sort of few years. And we already have a program that's like a peer-to-peer kind of support group program called Circles. And we're looking at kind of getting those mental health first aiders to be able to deliver that program either in their own agencies or out in the community, of creative community as well. So there will be some stuff on that. So the person who asked this question, feel free to get in touch, jump to Slack, which is the link I put in earlier, and we can maybe we can do some stuff together.